It is a canon event for everyone to deal with acne, and there's just so many different types of acne out there. There's inflammatory acne, non-inflammatory acne, cystic acne, whiteheads, blackheads, bro, just so many. And there's actually different ways to deal with acne depending on what type of acne it is. And so I'll be breaking down in the most simple terms possible for you to help treat these different types of acne that you might have. There are two main types of acne out there: inflammatory acne and non-inflammatory acne. We'll first talk about non-inflammatory acne, which is probably your more stereotypical acne that you've heard of: whiteheads and blackheads. Whiteheads are basically closed pores that are trapped underneath the skin. You're probably pretty familiar with them. If you ever see a whitehead pop up on your skin, odds are you're gonna end up popping it. I mean, the temptation is crazy, but actually just be careful because popping it can make your acne worse, unless you do use the correct tools and use something like a hydrocolloid pimple patch afterwards. But if you're just using your fingers to pop your whiteheads, then honestly, I just don't recommend. You're better off using skincare products that have active ingredients like salicylic acid or benzoyl peroxide. And the concentration that you might use can vary from anywhere from 2% all the way up to 10%. And contrary to popular belief, more does not mean better. It's actually the opposite. Less is more in this case. Using a lower percent concentration like 2% is probably going to be better than using something like 10%, because if you're using something like a 10% benzoyl peroxide cleanser, this is going to be super harsh on the skin because the percentage of concentration is just so high. And so this product is going to be way more stripping to the skin. However, if you use a lower concentration like 2%, you're still going to get the benefits of fighting the acne, but it's also just going to be way less stripping to the skin. Your skin's going to be better able to tolerate it, and you're just going to get better results because of that. So if you have the choice between a lower percentage and a high percentage concentration, in my opinion, choose the lower percentage concentration. You're probably going to yield better results. And then we have blackheads, which are basically open pores that have oxidized at the surface. And you're going to be using the same treatment as whiteheads. Use products that have salicylic acid and benzoyl peroxide. And if you've ever been to a skincare aisle, you've probably seen those nose strips that you can use to strip out those blackheads from your nose. And honestly, I would highly recommend staying away from those because those can be extremely stripping to the skin. They can be very irritating and it'll just make things worse. Instead, you should just opt for chemical exfoliants. Those are just going to be a better option at dealing with these blackheads. So now let's talk about inflammatory acne. This is obviously acne that is inflamed. The first one that we'll be talking about are papules, which are red inflamed acne that do not have any pus in it. This is like that stereotypical acne that you might see in cartoons with those red bumps. And to treat this type of acne, it's very similar to treating it with non-inflammatory acne. You want to use products that have salicylic acid or benzoyl peroxide. But also make sure that you're prioritizing a clean diet. Make sure that you cut out any artificial sugars from your diet. Have a lot of fruits, have a lot of veggies. Try to cut out any processed foods, because in general, your skin will improve if you do clear up your diet. The next type of inflammatory acne are pustules, which are basically inflamed bumps with pus. You can actually see this in many different areas like your chest, your back, and obviously even your face. Once again, the treatment is very similar. You're using products that have salicylic acid or benzoyl peroxide. You probably see a trend now. Salicylic acid and benzoyl peroxide are widely accepted as effective acne treatments. The next type of inflammatory acne I'm going to be talking about is nodular acne. These are large, painful, deep bumps that do not have a head. For this type of acne especially, make sure that you are not popping it. Nodular acne is difficult to deal with because topical treatments aren't as effective. Instead, you're actually going to be needing to make lifestyle changes in order to improve this. Make sure that your diet is in check, make sure that you're getting good sleep, hydration, make sure that you're exercising every single day. If you're optimizing all of these things, your skin should at least improve somewhat. Now, the final type of acne I'm going to be talking about is cystic acne. This is like everyone's worst nightmare because cystic acne is just a pain to deal with. These are deep, soft, pus-filled sacs that are often found in clusters. So not only do they just come in one, they come in groups of bumps. These are very difficult to treat, and sometimes you're going to need to get a steroid injection to help deal with it. But before you do resort to a procedure like this, make sure that everything is in check when it comes to your lifestyle. Make sure that you're getting enough sleep, make sure that you're drinking enough water, make sure that you're eating the right foods, make sure that you're exercising every single day. Because there's no point in doing all these procedures and treatments when you haven't even fixed the root issue. I hope this video was helpful for you guys. Make sure that you're just staying patient because dealing with acne is a very long journey. I think it took me like 6 months before I actually completely cleared up my acne. But in the end, it is worth it, guys. The skincare journey is long, but it'll definitely just be worth the wait. Hope you all enjoyed the video. Love y'all and peace.